The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. Hello, everyone. This is Karen Nickel, family nurse practitioner, and this is Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. A quick reminder about my course called The Perimenopause Answer. If you are going through this phase of life called perimenopause, I would love to have the opportunity to talk to you about the course to see if it's the right fit for you. There is a link on our website, itchyandbitchy.com, and our Facebook page, I and B Podcast, where you can schedule an appointment for a Zoom call with me. When you make an appointment, I will be sitting at my desk waiting for you to join the one-on-one Zoom call. When launching into the decades of young adulthood, the focus is usually on starting a career, making new friends or finding a partner, traveling the world, or just having fun. One thing that is not on the list is worrying about cancer. Unfortunately, cancer is occurring in more adults at younger ages, before they turn 40 or 50 or sometimes even earlier. In the 2025 release of the American Cancer Society's statistics publication, the report reveals that for women younger than 50, the risk of developing cancer is 82% higher than men, up from 51% since 2002. This marks the first time cancer incidence rates in women under 50 have surpassed men. What in the world is happening? The higher incidence rate is contributed to the cases of breast cancer, which predominantly affects women. And younger women tend to get more aggressive forms of breast cancer than older women. Why is this happening? Well, higher obesity rates, increased alcohol use, and having pregnancies later in life have, for a long time, been identified as risk factors for breast cancer. However, we're finally acknowledging that there are still lots of unknowns. There are plenty of young women diagnosed with breast cancer who have none of the three risk factors of obesity, alcohol use, or waiting to have a baby later in their productive life. So what else is at play here? We have lots of research on breast cancer prevention measures for women over 50, but not surprisingly, we have very little research involving younger women. Also, many individuals in this age group are too young for recommended routine cancer screenings. For example, mammography screening typically starts at age 40 and colonoscopies at age 45. And those ages were fairly recently lowered from 50 years old for both screening tests. So what needs to happen here? Because doctors and researchers don't yet know why early onset cancers are increasing, the focus has shifted to increasing efforts to diagnose these cancers early, when they are typically more treatable. Prevention would be ideal, but we're working on finding the cancers as early as possible, and family history has emerged as a key factor in early diagnosis. For example, if there is a family history of either colon cancer or colon polyps, we usually start screening with a colonoscopy 10 to 15 years before the family member who had it was diagnosed. So, if a first-degree relative, like your birth mother or your birth father, was diagnosed with colon cancer or polyps at age 45, your screening colonoscopy should be scheduled at age 30. The same is true for breast cancer screening. If you are a woman who is at average risk, not high risk, for breast cancer, you may start mammography screening every 2 years beginning at the age of 40. But if you have a family history of breast cancer, screening mammography should start 10 years prior to the age of that family member's diagnosis. For example, If the family member was diagnosed at age 40, you would begin receiving screening mammograms starting at age 30. In addition to the issue with timing of the screening test, young people's busy lives make it difficult for them to keep up with routine primary care visits. During these visits, a family history might alert the provider, who could then recommend earlier screening. Others may not go to the doctor because they have limited or no health insurance. That happens all the time. Or they believe their health problems are not serious enough to warrant a visit. This can result in a delayed diagnosis, which means the cancer may not be diagnosed until it has reached a more advanced stage, which, of course, can be harder to treat. For young people who have a significant family history of cancer in the family, some providers are starting to refer them to a high-risk clinic to undergo a risk assessment. A high-risk clinic is one that includes a team of specialists, including physicians, geneticists, genetic counselors, and advanced practice providers who work together to provide cancer genetics education and coordination of the genetic testing to help determine cancer risk. Many medical centers across the country now have high-risk clinics, including Yale Cancer Center, Mayo Clinic, Cleveland Clinic, and Dana-Farber Cancer Center, just to name a few. Memorial Sloan Kettering Cancer Center has programs for those already diagnosed with cancer, including young women with breast cancer, the Center for Young Onset Colorectal and Gastrointestinal Cancer, and the Lisa and Scott Stewart Center for Adolescent and Young Adult Cancers. More on early onset cancers and why it's happening after this quick break. Welcome back. The American Cancer Society annual report showed continued increases in such common cancers as breast, prostate, colorectal, cervical, and endometrial cancers in young adults. The increasing incidence rates of a number of cancers across generations, like millennials or Gen X, have led some epidemiologists to suspect that exposures in early life may be risk factors. Epidemiologists are looking at the earliest parts of life, like fetal development in the womb, infancy, and childhood. They're trying to figure out what is happening during this important developmental time that's related to the risk of developing cancer in adulthood later in life. One epidemiologist, Dr. Caitlin Murphy, a professor at UT Health Houston School of Public Health, has been evaluating the data collected in a study back in the 1950s and 60s of a big group of pregnant women enrolled in that study. Those women and their children, who they gave birth to, have been followed over time to the present day, so now more than 60 years. It has allowed Dr. Murphy and others to look at those things early in life that may be linked to cancer many decades later. In looking at the data, they have found things like medications prescribed during pregnancy that may be related to risk of colorectal cancer in young adult offspring. These meds are commonly prescribed for women during pregnancy, including anti-nausea meds, antibiotics for an infection, or synthetic hormones to prevent preterm birth. They've also identified maternal characteristics like a mom's BMI, body mass index, before she became pregnant, or how much weight she gained during pregnancy as important risk factors. Researchers are also looking at the health of the gut microbiome and its role in the development of early onset colorectal cancer. I talk about the gut microbiome in my course for perimenopausal women. This microbiome is comprised of bacteria, fungi, and viruses that number around 100 trillion. That's 10 times more cells that make up the human body. Because the health of our gut microbiome is overlooked, it is often referred to as the invisible organ. So, when we're looking at colorectal cancer and the early onset of that type of cancer, we have to think about the fact that the cells that get mutated and form the cancer are the ones that line the gut. These are the cells that are in direct contact with the contents of the gut, which includes food or whatever else we put in our mouths, including a variety of environmental exposures, and more importantly, the gut microbiome. So, getting back to how exposures early in life can influence our cancer risk, when someone is exposed to antibiotics early in life, we know that those antibiotics get rid of the bad bacteria, or at least that's the plan, but it also kills good bacteria, which sets the stage for other forms of bacteria that are not so good to grow in the gut. So researchers are looking into the link between an unhealthy microbiome and the risk of early onset colorectal cancer. Figuring out what puts us at risk for developing colorectal cancer early in life is a critically important task because colorectal cancer is now the leading cause of death in men younger than 50 years of age and the second leading cause of death for women younger than 50. In addition to looking at the microbiome, researchers are also investigating potential environmental factors and lifestyle changes such as increased alcohol, ultra-processed foods, and the use of PFAS, also known as forever chemicals. But the challenge of studying the effects of chemicals on the human body is that there are millions of chemicals. So, which chemicals should be chosen to study first? Also, if you study one chemical at a time, we'll never get an answer, at least not in our lifetime. We just don't have time to wait for scientists to test one chemical at a time. However, tools have been developed for a task such as this, testing maybe 10,000 chemicals at a time. But the research has to be funded, and that process takes time. And frankly, under our current presidential administration, funding for medical research has been significantly cut, so it will likely take even more time. Fortunately, there are long-term studies out there like the one I mentioned earlier on newborns and their mothers that started 20 or 30 years ago and have been followed over that entire time. So now, as those newborns in the study are aging into cancer risk, samples that were collected in those studies might be used for this purpose, even though that wasn't the purpose of the studies at the time that those studies began. Are our younger people just more inflamed? Could that be a contributing factor? This very thing has been examined, and one piece of info that comes through loud and clear is that when you look at the cells, the same colon cancer cells that you find in young versus old patients, identical type cells, identical type cancers, the younger patients' cancer cells have much stronger evidence of injury and inflammation. Are our younger people living in a more inflamed environment than the one in which I inhabited when I went through childhood and young adulthood? And what are the things that are causing that inflammation to happen? Definite contributors to inflammation include, but aren't limited to, diets high in bad fats, obesity, and smoking. Another thing researchers have explored is the cellular aging by looking at blood biomarkers for aging. And guess what? They found that in patients who have young onset colorectal cancer, as well as some other early onset cancers like breast cancer, they see that the aging blood markers seen in much older people, which we expect to see in much older people, are already present in these younger patients, suggesting a form of accelerated aging. We have long been of the mind that it is just one thing or one or two things that put young adults at risk for developing early onset cancers. But Dr. Murphy, the epidemiologist I referred to earlier in the episode, feels that a shift in our mindset is needed, moving away from the belief that it's just obesity or alcohol consumption or any other singular thing as the cause. Change that to truly looking at the possibility that it's something we may have never considered before. I've always believed in thinking outside the box, and we're going to have to think outside the box a little bit to figure out what is going on here. It could be sleep, it could be stress, it could be poverty, it could be environmental chemicals, it could be diet, it could be sedentary lifestyle. It could be all of those things. One other thing. There are special considerations and concerns when treating young adults when they're diagnosed in their 20s, 30s, or 40s. First, family planning. Since some cancers and treatments can create challenges with being able to become pregnant or produce sperm, patients may need to make a decision about freezing eggs or embryos or whether to consider sperm banking. Worries about whether or not insurance will cover the family planning is another stressor. Younger women may also be concerned that cancer treatment could cause early menopause. Chemotherapy may induce menopause, or hormonal treatments that are specifically designed to produce an early menopause may be necessary. Early menopause obviously shortens the fertility window and can have other negative effects on overall physical and emotional well-being. Body image may also be a concern. For some, the hair loss that occurs with chemotherapy is very distressing. The results of breast surgery can also negatively impact self-image. And when younger people are diagnosed with cancer, they may struggle with the impact the cancer or the treatment of the cancer can have on their sexual health and how they feel about their bodies. Some describe a sense of loss and fear related to developing or sustaining intimate relationships. After being diagnosed with and treated for cancer at a young age, they still have decades of life ahead of them, and so the possibility of recurrence can be a significant source of worry for some. I want to close with a couple of thoughts. If you are a person under the age of 50, or you are close to people who are under the age of 50, please remind yourself or remind them to seek medical advice in a timely manner if you have new and or concerning symptoms. For example, if you are 28 years old and you have an episode of rectal bleeding for a day or two, don't blow it off. Schedule an appointment to be seen. Yes, it may be hemorrhoids, but that needs to be determined by a medical professional. Also, to learn about how to support a healthy gut microbiome, please listen to the Itchy and Bitchy episode titled Trust Your Gut. No, I mean trust your literal gut, that is dated November 5th, 2022. Healthy gut is so important. Thank all of you for listening. Wherever you listen to this podcast, please leave a review and rate the podcast. Your reviews and ratings matter. Also, make sure you follow the show so that it will be automatically downloaded. That really matters. I encourage you to visit our Facebook page, I&B Podcast, where you can give us a like and leave comments or questions for me. Our website is itchyandbitchy.com, where there are blogs with some of our subjects available for you to read. Also, on the Facebook page and website, we have the information about how to schedule an appointment with me so we can chat about how my perimenopause course can help you if you're going through this phase in life. As always, thanks to Forrest Wenzel, our producer and composer of our theme music, and the person who does all the behind-the-scenes work to make this podcast possible. Thank you so much, Forrest Wenzel. Forrest is days away from ending his first very successful year at Peabody Music Conservatory. Boy, that went by quickly for me, And maybe it did for him too, but maybe not as fast as it did for me. Remember that your health is in your hands.